I'm Kenda Sutnell. I'm the Executive Director of Birth In Color RVA, which is an advocacy, policy-driven, and a doula collective. We work on different policies for legislation. We also make sure that all people of color who are pregnant get the proper care that they need by providing them evidence-based information so that they can make their own choices. And we also help them to pull out their empowerment so that they can feel empowered during the birth journey.
Awesome. So how did Birth In Color RVA start, and how long have you been involved?
I'm one of the founders, so I really helped create it. What happened was, like, all of us were doulas originally anyway, but the maternal mortality rates were alarming. So we all collectively was like, okay, we need to have a central location where they can actually find people of color doulas, Black doulas, so that they know where we are. And that was one of the biggest things that the community was saying, is that they could not find the Black doulas. So therefore, we created the collective based upon that, and we wanted to help to eliminate the health disparities.
That's great. So this perfect lead into this question then. Tell us about how Birth In Color RVA meets at the intersection of racial justice and reproductive rights.
So with racial justice, I teach racial bias training to healthcare providers. So that's one of the ways that we do that. We help to overcome by making sure that we provide education to healthcare providers, to hospitals, to pretty much the whole community about what it is, what the different biases are, and how to help eliminate them, and how to also, tell your friends, like, if you feel like they're being racist or anything like that, educate them, because sometimes people don't understand that they are being racist. That's some of the stuff that I've gotten. And just to make sure that they understand, because what we do know is that some of the racial bias trainings are created by people that's not people of color. So you've never experienced it, so you don't know how we actually feel when it comes to certain things. And then how we meet reproductive rights. I typically don't talk about reproductive rights as much, because essentially reproductive rights is framework. It's more individualistic instead of the holistic approach. So I always like to say reproductive justice. And we reach that by making sure that everyone knows that they have their own rights in their bodily autonomy over themselves, and they can make their own decisions. And we typically educate, support any way that we see fit, along with entering in different legislation to help that on the state level as well.
Awesome. So you talked about Black maternal mortality earlier on. So during this General Assembly, lawmakers signed off on bills that would create work groups to study maternal mortality and infant mortality in the Commonwealth. Why is this a big deal?
That was a huge win because no one knows what's actually happening. According to some research and data, 68% of the maternal mortality deaths could have been preventable. And so Black women dying 3 times higher than white women is unacceptable. It creates fear for them even wanting to have children. And then also you have the infant mortality rate, which is 9 times higher for Black women than white women. And so not only are the moms dying, but now the babies are dying. And so that's alarming. And without the review boards, no one knows what's actually happening. And when it came to the infant mortality, I just happened to get the data. And once I saw the data, I was like, so they didn't tell the community that this was what the rate was in Virginia? And so that's when I was like, okay, we need to actually do something about it, and went to patrons to see who would be willing to carry that particular bill.
Awesome. So once they get this information, what type of action do you expect to see?
I'm hoping to see a lot of action, different programs. I know one of the major factors where they were talking about funding, and I said, well, clearly the programs that we have aren't really getting to the people that they need to get to, or it's has to be racism, or something deeper is actually happening. And so we can create all the plans that we want to, but if racism is still a factor, then we need to go back to historically and recreate these systems.
Yeah, that's awesome. I totally agree. And there's lots of racial disparities in our healthcare system, which lead to all kinds of inequities. This question isn't here, but I think it's important to ask. Why do you think it's important that Virginia declare racism a public health crisis?
When I saw that Delegate Aird carried that, I was extremely happy, because someone has to set the tone for the United States. And that sets the tone that we are no longer going to deal with racism, and we're going to implement things that will help to overcome it. Not alone, let alone people shy away from even talking about racism and how it affects certain systems. The school system, it affects the school systems, it's affecting the healthcare. So it's affecting in every single intersection, racism is a factor. And so until we can actually say racism is affecting these systems, then we're not going to ever get anywhere. I remember when we first started Birth In Color, and people was like, but why were you just targeting Black women? Because Black women are dying, just like Black people matter. We're the ones that's dying. So until you can address it, until you can actually say it. And what bothers me the most is when people can't say racism is an issue. And I will make them say it. Like, no, racism is the issue here. Like, say it so that other people can say it and put things into effect for it.
Yeah, because they don't want to say it because they can avoid taking responsibility, their own personal responsibility for it, I feel like. And
exactly.
And I totally agree. You know, it's Black Lives Matter because it's Black people that are being killed by police. Black Mamas Matter because it's Black women, Black mothers that are dying. So, like, let's look at the issue. Let's look at the deep inequities in our system. Let's look at the racism that it's rooted in, and finally bring justice to people, you know? So what other kinds of wins did Birth In Color see during the 2021 General Assembly?
We actually saw the 12-month birth control, where Medicaid recipients will be able to get a 12-month supply of birth control. We actually had the work group for the prison incarceration for pregnant people. That was a huge win. A lot of people was like, how did you get them to agree to that? But it was really, really important. And that's how we're creating these intersections, is bringing them all together. Maternal health affects juvenile justice. Juvenile justice will affect social justice, economic justice, and food justice. And so until people realize that all of these things actually intersect together, we will always still be at the same tables preaching the same song until all of them are addressed.
I hear that. And, you know, that's why people got to vote. So we have people in power like Delegate Aird, Delegate Ayala, who are bringing these really important bills to the General Assembly. So what lies ahead in the fight for reproductive and racial justice in Virginia?
Trying to figure out establishing real systems that really, really work and show results. I know that a lot of people was like, you know, Birth In Color has only been around since 2018, and we have created way more systems than organizations that have been around for years. And so us keeping our feet on the pavement and continuing to do the work that we say we do, and getting those measurable outcomes that we're looking to obtain.
Awesome. Do you have anything else you want to talk about? We're wrapping up right now.
Nope. You can always follow us on Birth In Color RVA on Instagram, Facebook, and our website is birthincolorrva.org. We recently launched the Lynchburg location. We are launching Hampton Roads and Northern Neck location. So be on the lookout for those.